gentlemen. And I see there is a lady. All right. Jill Fruge, MD, earned her degree in medicine from Louisiana State University Health Sciences Center in Shreveport and completed her internship at Earl K. Long Medical Center in Baton Rouge. She performed her residency in dermatology at Louisiana State University Health Sciences Center in New Orleans. Dr. Fruge will be practicing at Our Lady of the Lake Physician Group Dermatology with Dr. Tennyson. Dr. Fruge.
Thank you. Good morning. All right, so I hear this is going to lead us up to lunch, so that's a good thing. So like they said, I'm Dr. Fruge. I am originally from Shreveport, Louisiana, but I married a boy from South Louisiana, and you can only keep him out of South Louisiana for so long. So we have moved down here, and I'm the newest dermatologist in town. I have joined the Lakes Physician Group. I'm with Lacey Tennyson. We're over on Jefferson Highway, and I've been there for a little over a month and a half, and it's been a lot of fun so far. So today, we're going to talk about the sun, your skin, and not letting the big one, as in skin cancer, get away, okay? So the first thing we're going to talk about is the sun and the effects that the sun has on your skin and why we as dermatologists are so concerned about the sun and how much sun exposure you have. And then we're going to talk about the signs of the different types, the three main types of skin cancers. We're going to look at some examples of them and see some pictures and all of that. And then ways to prevent skin cancer. Let's see. There we go. Okay, so the sun is a great thing. In South Louisiana, we have lots and lots of sunny days. We like to be outside. We like to go fishing. We like to go hunting. We like to work in our yards. And so most of us in South Louisiana get a significant amount of sun exposure throughout our life. The sun produces three main types of rays, only two of which do we really concern ourselves with, because those are the main two that reach the earth at any significant level, which is UVA and UVB. And the reason why you need to know about these is that the different sunscreens cover the different types of rays, okay? Majority of sunscreens out there are going to give you UVB coverage. Most of them do not give you UVA coverage, and the only way you can get UVA coverage is if you have a broad spectrum sunscreen, and that has to be written on the bottle, okay? Both UVA and UVB can contribute to skin cancer, and I usually say that the A rays age you and the B rays burn you, okay? So both of them are important, and that's why it's important to know about those. And then the sun, and particularly the UV light, directly damages our DNA in our cells, okay? And so the sun, the rays are going to hit the cells in our skin, and the DNA in those cells will get damaged every time ultraviolet light is exposed to your skin, okay? Why do you not form a skin cancer every single time? Well, our body is really good at finding out those little damages and repairing them, okay? However, as we start to collect more and more damage, our body does not do as well as keeping track of all that, and then the damages kind of start to collect and spill over, and then we start having damages that cannot be fixed, and then that's when we develop skin cancer. The sun also plays a role because it inhibits our immune system. So our immune system, most people talk about the immune system in fighting viruses and bacteria and funguses, and it's a very important part of the immune system. But another part of our immune system is what we call cancer surveillance. And so our immune system kind of acts like the police, and it kind of keeps cells in check. And so cells that start down the road of becoming cancerous, our immune system plays a response in getting rid of those cells so that they don't turn into cancer. However, age and also in our skin, the sun inhibits that policing ability of our immune system. And so as we get older and we start collecting more and more sun damage over our lifetime, not only do we have more damage, but we also aren't able to police it as well as we were when we had less damage and we were younger. And so that's why we see the majority of skin cancer in patients over the age of 55, because of these two mechanisms. The sun is absolutely directly related to the development of skin cancer. Some types of skin cancer are more associated with how much sun you've had over your life, and other types are more associated with how many sunburns you've had over your life, but they're all related to the sun. Now, the majority of our sun damage that we get is going to be when we're young. So when we're kids, when we're teenagers, and when we're in our 20s and we're invincible and we don't, we can be outside all day long, or for a lot of us in the room who didn't have sunscreen when you were that age and your mom said, just go play outside. The majority of our sun exposure is when we're young, okay? But it's the little bit of sun exposure that we get as we get older that is the key factor in what tips us over into developing skin cancer. So I hear all day long from my patients, yeah, well, I don't go outside that much. And I would say, I know that, I understand that, but it's the little bit of sun that you get walking to your car, walking to your mailbox, driving your car, running into the store, that adds up, and that leads to the development of skin cancer. And I will also tell my patients, if I have two people who have significant sun damage, who we're cutting and freezing and all of that all the time off of, if one of them starts to wear hats and sunscreens and becomes very vigilant about their sun exposure, and the other one doesn't, we have much less to do each time I see the one who actually is wearing the sunscreen than the one who says, oh, well, I'm not going to worry about it. I'm too old, had too much damage, I'm going to move on. So even though you're not getting that much sun now compared to when you were younger, it is still important to try to be vigilant about sunscreen and sun protection, because it can be the difference between having to have lots of things cut off or frozen off and just having to have one or two things cut off and frozen off.
I have a question about sunscreen. Is it more important how much you apply it as opposed to the SPF number?
So we're going to talk about sunscreen in just a little bit, but to address your question, so most people do not put on the amount of sunscreen that you need to get the SPF that's needed. Most of us put on about half of the amount of sunscreen that's needed in order to achieve that particular SPF that's on the bottle. So I tell patients, if you're one that you don't like to put much on and you're not going to put much on, I'd rather you have a much higher SPF, because I know you're not really going to even get that particular SPF because you're putting so little on. However, you also don't want to be the person that's literally dripping with sunscreen, because at that point in time, it gets to a point to where no extra sunscreen is going to give you any more protection. So, but it's usually not a problem with people putting on too much. It's almost always a problem with people not putting on enough. So the peak hours of sun, so the sun is most intense between the hours of 10 a.m. and 2 p.m., and that's going to come into play when we just talk about sun protection and behaviors. And then sunscreen. So the two ways that sunscreen works is that it's either going to absorb the ultraviolet light and prevent it from reaching your skin, or it's going to scatter it from your skin and prevent it from reaching the cells, okay? There are two main types of sunscreen ingredients. There are your chemical blockers, which these are all examples of chemical blockers, and then physical blockers, which is zinc and titanium. So these are going to be the main ingredients you're going to see on the back of your sunscreen bottle. Why is it important for you to know this? Well, a couple of things. Our physical blockers, zinc and titanium, because they mainly act by scattering the ultraviolet light. And they have a very broad spectrum of action. They have the broadest that we have out there, so they're going to give you the most coverage. Also, the biggest complaint I hear from especially my male patients when it comes to sunscreen is they hate to put sunscreen on because they sweat, it gets in their eyes, and it burns. So majority of the time, the reason why it's burning is because there is a chemical sunscreen in the sunscreen itself. If you have a purely physical blocking sunscreen that only has zinc and or titanium, even if it gets in your eyes, it should not burn. And so that's why it's important to know what type of sunscreen you have. Also, the physical blockers tend to be in bases that don't run as easily, so they tend to stay on the skin much better, and they're resistant to sweating. The zinc, you may remember, it's like 30 years ago, the lifeguards that have like the orange or the pink nose. So that was zinc oxide. Now we have micronized it so it doesn't leave as it's not opaque, it's actually translucent, it rubs in. And then there are some sunscreens that have a tint to them so you don't have that white shine from the zinc left on your skin, and it's just much more cosmetically pleasing. Sunscreens come in a variety of bases. There's several of them that are very nice for wearing every day because it feels good on your skin. It's not heavy. It's not going to run. It doesn't have an odor. And then there's also some that are, we call them sports sunscreens for the most part, that are going to be in a base that really, when you put it on, it's not going to come off. It's sweat proof. It's, for the most part, water resistant. It just wears much longer. And so there's lots of different types of sunscreen, so that's why it's important to know what's out there. My father-in-law is a mailman, so he gets lots and lots of sun. And so I'm constantly giving him sunscreen to put on, and there's a couple that I really like, and he'll tell me, it doesn't matter what I do, I cannot get this stuff off my skin. Even the next day, you can still see that it's on there. And I say, that's good. That's what I want, because you're gonna be protected while you're out there. And then SPF is the other big thing. So SPF is a value of how much sun is being protected from your skin. And so it's not so much that SPF 60 does not protect you twice as much as 30, okay? It's kind of in a percentage, like a logarithmic percentage. So SPF of 60 probably protects 98% of the rays from hitting your skin, whereas SPF 30 may protect you 95%. So you're still having a significant amount of sun protection. So, you know, when you start getting those really high SPF values, you're not getting that much more protection. As a rule, we recommend, and the American Academy of Dermatology recommends a 30 as the minimum that you use. And then, like I said, most people don't put enough on. And so making sure that you're putting enough on and is important. So now we're going to kind of talk in the meat of the talk about skin cancer. So first we're going to talk about the precancers, and then the three main types of skin cancer, and then the risk factors for the development of these. So this is a word, if you are over the age of 60 and you've had lots of sun in your life, there's a high chance that you have some of these. This is actinic keratosis, and this is our precancers, okay? So it's specifically a precancer to squamous cell carcinoma. It is usually a red flaky spot, and you can feel it much sooner than you can see it. So if you've ever been at a dermatologist for a skin screening and they're looking at your skin, a lot of times we'll kind of feel the temples and feel your nose and kind of, you know, rub our finger around your cheeks, and it's because we're looking for these. We're looking for these scaly spots that you can feel before you see. You see them a lot in the areas that have gotten a lot of sun. So here on the temples, on the forehead, on the nose, and on the backs of the hands. This is a much more impressive one. I'm sure this person probably realized that there was something going on. But oftentimes, this is how we find them. You know, just some rough spots that you might be able to knock off, and then the next week it comes back. It doesn't matter how much of your wife's cream you put on there. You can't get that little rough spot to go away. That is usually an actinic keratosis, okay? As our natural sunscreen, our hair starts to go away and we start getting more and more sun up there, we oftentimes see it up there because often we forget to protect that part of our body. And then why do we care about these? So actinic keratosis, 1 in 10 will become a skin cancer, okay? They're very, very easy to treat. We can treat them with our cold spray, which is liquid nitrogen. We can, there's a variety of creams we can put on there that will irritate them or activate the immune system enough to where the body takes care of them. There's also a procedure where you can put a solution on your face and then expose yourself to a blue light that's available in some dermatologist offices that can treat them. So I'm telling you this because they're very easy to treat. And so I tell my patients, if I see one, it's a 1 in 10 chance, why don't we just get rid of it? You're going to have a scaly spot for a few days and then you don't have to worry about it. It does tell us, though, that you've had enough skin cancer to develop, you've had enough sun exposure to develop enough damage to start developing precancers that we do want to watch you closely for the development of skin cancers. And also, this may not matter as much for the men, but for your wives, this also leads to kind of an older look. And so when we treat these and get rid of these, we're getting rid of a lot of the damage, and you kind of have a more youthful, cleaner look. And a lot of the wives appreciate that. So now we're going to talk about skin cancer. So when we talk about skin cancer, we kind of lump them into two different classes. There's the melanoma skin cancer, which is the mole type that we're going to talk about in a little bit. And then there's the non-melanoma skin cancer. And here we're mostly talking about basal cell as well as squamous cell carcinomas. They're very, very common. 1 in 2 men and 1 in 3 women will develop a non-melanoma skin cancer in their lifetime. Majority of these are diagnosed after the age of 55, so majority of us in the room are at risk for this. And then once you develop your first one, the risk of developing a second one is very, very high. In fact, in 5 years of developing your first one, half of women and nearly 3/4 of men will have developed a second skin cancer. So when you come see us and we do diagnose you with the skin cancer, don't be a stranger, don't run away and never come back. We want to see you because we want to find the second one early so that we can take care of it without having a big scar or having, a big issue with before it can spread or cause any major damage. So first we're going to talk about the basal cell carcinoma. And this is the most common type of skin cancer. There are very many different types of the basal cell carcinoma. We're going to talk about the main types. They're common in areas that have been exposed to the sun a lot, especially intermittent sun exposure. So if you have a history of a lot of sunburns, you have a tendency to develop these basal cell carcinomas. They're common on the head and the neck, and then we also see a variety that I'm going to show you of it on the trunk, the chest and the back. So this is normally, it starts off as a pink bump. Usually it's kind of shiny. So usually it looks like this or like this, and most people either don't notice it or don't worry about it, okay? It is not normal to develop a new mole after the age of 35. So if you got a new pink mole after the age of 35, it's probably a good idea to get it looked at. Also, a lot of people will confuse these with bug bites, okay? It is not normal for a bug bite to last longer than about a week. I had a patient the other day. They had a bug bite that had been there for 3 months and it formed a sore and wasn't healing. So, I just reminded him, next time you get a bug bite, if it's not healed in a week, I need you to come see me, okay? Because more than likely it's not a bug bite. The other thing that most of the time that brings people in for these is that they will eventually develop a sore on them. They'll actually have an ulcer in the middle of it. And what happens is you're washing your face or you're shaving or whatnot, you bump it and it bleeds. Well, then you get the bleeding to stop. Well, the next time you do it, it starts bleeding in again. And so you get the bleeding to stop and it just kind of recurs. It's like this sore that doesn't want to heal, okay? That's also another telltale sign of a skin cancer, okay? And it's probably one of these types of skin cancer, the basal cell carcinomas, because they love to form a little sore in them. This is the variant that we see on the trunk, the chest, and the back. So it's kind of a red scaly spot that's there that may be growing. And it's new. This is not a spot that you've had before. The next type is our squamous cell carcinomas. It's technically the second most common type of skin cancer, but we do see an awful lot of these. This one is absolutely related to how much sun you've got over your life. So our patients who work outside, our farmers, our construction workers, patients who fish a lot, who golf a lot, who play a lot of tennis, or outside a lot. This is the one that we see very commonly in these patients. It's going to be on the head, including the scalp and the neck, but also it loves the backs of the hands, okay? Because if you think about it, most of us don't put sunscreen on our hands. Most of us don't wear clothing that covers our hands. Most of us drive, or when you have your hands on the steering wheel, that sun comes through and hits the backs of your hands and causes a lot of damage. So squamous cell carcinoma loves the backs of the hands, and we have to be careful because this is one that does have the potential to spread to other parts of the body. If it's on, and especially the high risk areas for that are the back of the hands, the lip, and the ear. So You do have to be careful. Here's some pictures. So here is one. It usually starts as a hard spot or a scaly spot that just doesn't want to go away. Sometimes it can form a sore in it, or it can actually become painful, and then sometimes they'll actually even form little horns out of them. So if you ever start growing a horn, make sure you come and see it. That's not normal. It's not just age spot, okay? Again, it loves the lower lip. Our lower lip gets a lot of sun over our life. Our upper lip, not so much because our nose shades it, but our lower lip gets a lot of sun. So if you have scaly spots on your lip, and especially if you have a hard spot or a tender spot or a sore on your lip, that needs to be seen about quickly. Let's see. And then otherwise, we see this as just kind of a red scaly spot that doesn't want to go away, and then they can get quite thick like you see on the back of the hands here, and a lot of times you can knock off the top of it and it'll come right back. And then you can imagine that from here you can grow a little horn out of there, and we do see that very commonly. So these are all examples of our squamous cell carcinoma. Now we're going to talk a little bit about melanoma, and this is the one that gets a lot of press because this is the one that can spread and can lead to ending your life. It can occur at any age. Okay, I've seen melanoma in someone as young as 5, and I've seen it in someone as old as 99. So in this one, it doesn't matter your age. Men that are over the age of 65, we have an increased risk of melanoma, and we do see a lot of melanoma in that population. We can see it in areas that the sun hits and in areas that never see the sun. Melanoma can occur on the palms of your hands. It can occur on the bottoms of your feet. It can occur on your bottom. It can occur in your scalp. It can occur anywhere on the body. It can occur all by itself, or it can develop from a mole that you've had possibly even all your life, okay? And so it's important if you are a moley person to know your moles and to know where they are and make sure that they're not developing melanoma in it. But it's also important, especially like I said, a new mole over the age of 35 is not normal. So if you have a new brown or black spot, that is very concerning. And melanoma is not always brown or black. There is a variant of melanoma that's called an amelanotic melanoma that is pink. So a new pink spot, again, just like I mentioned with the basal cell carcinomas, is not normal and needs to be looked at. And this is the one that has potential to metastasize, which means spread to the other parts of the body, and it can do it quickly. It can do it within weeks with some of the different types, certain subtypes of melanoma. So it is important that you are vigilant about this, that you look. I ask people all the time, when was the last time you looked at your back or the backs of their legs? And they say, well, I've never done that. And I said, well, that's why you need to come see me so that I can look at your back and the backs of your legs and make sure you're not missing anything. But if you have someone who lives with you at home, it's important that you have them just kind of glance at your back and the backs of your legs, the areas that you're not looking at very often, maybe every couple of months, just to make sure there's nothing new popping up there. We have 2 different rules that we use when we're talking about melanoma. The first one is this one here. We call it our ABCDE rules. And it's pretty easy. So we look at asymmetry. So if one side of it doesn't look like the other side, or the top half doesn't look like the bottom half, that could be a concerning mole. We look at the border of it. If it's not smooth, if it wants to form little feet or little fingers that are starting to kind of grow outside of the normal border of it, that's extremely concerning. We look at the color. If it's more than one color, and definitely if it's more than 2 colors, it's extremely concerning, okay? And when we talk about colors, we're not just talking about variations of brown, but especially if it has brown, black, and pink, or gray, or blue, then those are all concerning. The diameter, and 6 millimeters is about the size of a pencil eraser. So if you can stick a pencil on a mole and it covers it, more than likely, not always, but more than likely that mole is going to be okay. Not every mole that's bigger than 6 millimeters or bigger than a pencil eraser is melanoma, but we do like to make sure we've looked at those very closely and that they don't have any signs of melanoma in them. And then the most important factor in this rule is the E, evolving. So if it is changing, if it's always been a small brown spot and you look down one day and you say, hey, that spot's grown, or that spot kind of has a new little side to it, or that spot has a new pink bump in it, or a new brown or black bump in it. That is extremely concerning, okay? So if it is changing with time, then that is one that we need to look at. The other rule is mostly for the people who are moly. So you're either someone who makes a lot of moles, or you're someone who doesn't make a lot of moles, okay? And it's okay if you make a lot of moles. I make a lot of moles. So, but if you're someone who makes a lot of moles, most of the moles that your body makes are going to be a couple of different types of moles. But you're going to kind of make about 1 to 3 different types of moles, and all of your moles will have at least another mole on your body that matches it, okay? They're at least come in pairs. And we call this sign the ugly duckling sign. So it's the mole that doesn't look like all the other moles, okay? So even if you have 100 moles and they all look the same, but you have that one that doesn't look like, you can't find a match to it, that's the one we need to look out for, okay? So if you are a moly person, then the ugly duckling sign is another very, very important sign for you to know about. Let's see, there it goes. Okay, so we're going to look at some pictures of melanoma. So here is and the other thing I wanted to mention is most people think that if it's flat, it's not a problem. Most melanomas are flat, okay? So even if it's flat, it needs to be looked at carefully. Melanomas can also be just a solid black bump, and that's in a very aggressive type of melanoma. But just because it's flat doesn't mean it's harmless, okay? So you still have to look at all of these moles. So this particular mole here, you can see that you could call that symmetrical, but the color, you can see you have lots of different kind of colors. You kind of have a grayish area, you have some light brown, you have some areas that don't have any color at all. The border, it's not very smooth. It's kind of wanting to be a little jagged, and you kind of lose it up here. And then I bet if you asked this person, it had been changing, and this is a melanoma. This is probably a more obvious type of melanoma here. I wouldn't be surprised if this person had this mole all their life, and one day they looked down and saw this new black spot over there on the edge in the corner. So here you don't have symmetry, you have lots of different colors, and you have this new spot that's probably evolved. Again, like I said, melanoma can also look like just this spot. If you erase the rest of it and just look at that kind of shiny black spot, that could be a melanoma all on its own. Melanomas can be small, and we actually prefer them to be small because we can manage them much better, and there's less likelihood that it is spread to other parts of the body. But you can see this is on the arm, so this is a fairly small little brown spot on the arm. But if you look closely, there's several different colors. There's browns and pinks. It's not quite symmetrical. It kind of has this spot here that wants to kind of reach out and grab and kind of start walking away in that direction. So this is also melanoma. Yes?
If they're small, do they tend not to metastasize yet?
Not necessarily. It depends on the subtype. The nodular variant, which is normally what if you erased all of this and you just had this round black thing, those can, and usually it's a bump, those can be very small, and those are extremely aggressive even when they are small. Let's see. Here's some more examples of melanoma. Again, this one's probably more obvious. You know, there's no symmetry here. There's lots of color variety. The border, this is what I'm talking about when I say it has some little fingers or a little foot that's wanting to stick out there. And again, there's another little pod coming out. And then, like I said, if you erase this spot all on its own, that could be a melanoma too. Melanomas, there's a type of melanoma that occurs in the areas that we get lots and lots of sun, and it kind of comes from a quote-unquote sunspot. As you can see in this lady, she's probably had a brown patch on her cheek for years, maybe even 20 years. And then one day her daughter or somebody said, you know what, you have lots of different colors in that patch and you didn't have that before. And this is a type of melanoma. Luckily, this type of melanoma usually is a much more slow-growing type of melanoma, but a lot of times they're very large melanomas and they're in cosmetically sensitive areas, so they are very difficult to treat. But so if you have a sunspot that is growing or that has lots of different colors in it, that's very concerning. Like I said, melanomas can occur where we don't necessarily think about moles. So the bottoms of our hands, the bottoms of our feet, our fingernails, okay? This can occur in anyone, but we oftentimes mention this type of melanoma to our African American patients, okay? A new brown line in a nail is concerning. Now, a lot of times we see this in young children. They come in, they have a new brown line. You can have normal, harmless moles in your nails that form brown lines. But if you're older, especially if you're over the age of 35 and you have a new brown line in a nail, that is concerning. If your brown line is getting wider and wider, that is concerning. And then definitely if the brown line is starting to show up as brown on the skin around your nail, that is extremely concerning. And this particular type of melanoma is a very aggressive type of melanoma. This is also a melanoma. This is just a brown patch on this lady's nose. If you get close, I'm sure there may be different variations of brown in that patch. But like I said, any new brown spot or any brown spot that's changing in size or color needs to be looked at. So our risk factors for skin cancer. So our non-melanoma skin cancers are absolutely related to how much sun you've had, both in the long term over the years as well as your intermittent intense exposures, and those are your sunscreens. So if you're someone who doesn't go play golf often, but every time you go play golf you get a sunburn, then you still are at risk for skin cancer. Also, if you've had prior radiation, so a long time ago we used to use radiation to treat acne. We still use radiation to treat many different types of cancer. So if you've had radiation for your prostate cancer, or for a sarcoma, or for lung cancer, or breast cancer, or whatever, those areas that receive radiation are at increased risk for skin cancers, and you need to be careful because those can be very aggressive. We, in dermatology, used to use a treatment called PUVA. It's still used, but it's not very popular anymore. But if you've ever had PUVA therapy, you are at increased risk for skin cancer. We do like to monitor you closely. If you've been exposed to arsenic, and most people, most of the times you're going to be exposed to this from well water. However, there are some medications, particularly some of the newer chemotherapy agents that have arsenic in them, that increase your risk of skin cancer. And then immunosuppression. So certain viruses can suppress your immune system, but the big one is if you've had an organ transplant. So if you've had a transplant and you're on medication to prevent rejection, you are at a 40 times increased risk for developing skin cancer, and you need to be seen by a dermatologist every 3 to 6 months. And I usually recommend more every 3 months because a lot of times you develop them faster than we can catch them, and a lot of times they're very aggressive. The other thing that's not on here is occupation. So welders, the exposure to the light, you are at increased risk of skin cancer. And then other occupations that may expose you to certain types of chemicals and oils and things like that can increase your risk. For melanoma, sun exposure does play a role, particularly in certain types of the melanoma. And most importantly is the history of sunburns, and this is where you need to think about your children and your grandchildren. So the number of sunburns you have as a child is the #1 risk factor for the development of melanoma. So make sure that your kids and your grandkids are getting sunscreen on when they're out there playing, okay? But in melanoma, family history comes to play too. So there's a direct relationship to if you have a relative who has melanoma, your risk is now increased for developing melanoma. And I tell all my patients who I diagnose with melanoma, I want to see your kids and I want to see your grandkids at least once, but probably more frequently, to have a skin check so I can look at your risk factors and I can tell you what to look for, and I can maybe point out some moles that we need to pay attention to, okay? So how do we prevent all of this? So we can use our behavior, so we can try to avoid the sun, and mostly try and avoid that peak sun from 10 a.m. to 2 p.m. And then also when we have to be in the sun, to seek shade as much as possible. Using clothing to protect our skin is important, like hats. Baseball hats help some, but especially we recommend the wide brim hat, and if you can find one that has something to protect your neck on it is really good. Long sleeves and long pants, which I know is really hard to do here in Louisiana because it's hot in the summertime. However, There's lots of different types of, mostly they're in like the fishing department, but there's, they've really come a long way with materials and being able to provide something that's long sleeve or long pants that also breathes really easily and allows you to stay cool, but also protecting your skin. And then lastly is sunscreen. It doesn't work if you don't put it on. It doesn't work if you don't put enough on, and it doesn't work if you don't put it on enough, okay? So finding a sunscreen that you like, that will stay on your skin and provides you enough protection is very, very important. There are a million different sunscreens out there, okay? And there are some that are much better than others. There's some that are available online, and then almost every dermatologist's office that you'll walk into sells sunscreens, and usually the sunscreens that we sell are the mostly physical blocking agents that have a nicer feel and maybe easier to wear, that don't tend to run when you sweat and those types of things. But find a sunscreen that you like and wear it. Now, I recommend I tell my patients every morning when I wake up, I put sunscreen on my face, my neck, and the backs of my hands, because I know even if I'm not going to go spend the day outside, when I walk to my office, when I walk to my car, when I go to my mailbox, I'm going to be getting some sun, and I know those are the areas that I need to protect the most. And then if I'm wearing short sleeves or whatever, if I'm going to be out in the sun, I go ahead and add more sunscreen. And then the physical blockers are the ones that we recommend the most, and then at least a 30. And then the other thing is coming to see us. So, a lot of times patients come in and they say, I'm worried about this spot, and I can look at it and say, that spot is nothing, but this other spot over here is something, and they didn't even know it was there. I tell my patients all the time, I'd much rather you call me and come see me and I can tell you that it's nothing to worry about than you sit at home with a skin cancer stewing that you just don't want to come see us about. Majority of the time, skin cancers can be easily taken care of with simple procedures like surgical excision where we stitch it afterwards, or certain types of scrape and burn procedures we can use. It doesn't have to be something that causes you a lot of suffering and a lot of scarring and all of that, but we need to see you in order to take care of them, okay? And definitely, if you've had a skin cancer in the past, don't run away. Don't be afraid of us. Come and see us, because we can either treat the precancers before they become cancers, or we can catch the cancers when they're small. And then, like I said, if there's any family history, particularly of melanoma, make sure that you get your family members to come see us too. Okay? That's about all I have. I think we're going to open up for questions. Yes?
Skin tags, where do they come from?
So skin tags usually occur in areas where there's friction. So oftentimes it occurs underneath the arms, it occurs along the collar where your collar rubs often. Sometimes then it can occur in the groin area. In women, a lot of times they will occur underneath the breast. Most skin tags are completely harmless, okay? Now, there's never 100%. But majority of the time they're harmless. We can remove them. It's usually pretty easy to just snip them off. However, insurance companies don't cover that. So there's different ways that dermatologists will kind of take care of them for you if they really bother you. But if you have a skin tag that doesn't look like all the other ones, or is growing quickly, or it's like painful or bleeding, it's a good idea to get it taken care of. Yes?
Is any sun beneficial at all?
So, sun is important in the creation and production of vitamin D. You can get vitamin D in other ways. You can take it in either in your diet, or there's vitamin D supplements. And they have actually looked in the amount of sun that you need in order to produce enough vitamin D is actually very, very small, okay? So vitamin D is essential in our body. So I'm not saying you need 100, some people probably need, who are very high risk for melanoma and other things, need to be no sun exposure at all. But it's okay to get some sun, a little bit of sun. Usually 5 to 10 minutes a day is about all you need to produce some vitamin D. So you don't need to go lay outside or spend an hour outside, in the hot sun, just to get your vitamin D. And then, like I said, there's other ways to get it too.
Yeah, plus we got some collection areas on the bald spots that you get a better exposure.
Yes.
Does the risk change as the seasons change?
So they do here in South Louisiana, not as much as they do in other parts of the world. So it all depends on the intensity of the sun. and then how much sun you're getting, determining on the seasons. But in the wintertime, you're not as much UV is reaching the Earth's surface, and so you do have a little bit less. However, they always say, you have to be careful on cloudy days, because a lot of times it's cloudy and you're not going to get hot and you don't think that you're going to get a lot of sun, and most of the time you end up spending more time outside than you normally would, and you end up getting way more sun than you would have gotten if it would have been a sunny day. So it's important, even though it's a cloudy day, to go ahead and use some sun protection behaviors and put on sunscreen and try to prevent getting too much sun.
The risk is, the seasonal risk is due to the sun angle.
Yes.
As opposed to the weather.
Yes. Yes.
Is that true that we're getting worse rays in the clouds on a cloudy day opposed to a sunny day?
You know,
Or is that a myth?
I don't really know that there's any evidence that looks to quantify. I think that you do get some scattering of the rays from the clouds, but I know for sure that the rays still come through the clouds, maybe not as intense as they do without, and then for sure it affects our behavior more than anything else, and so a lot of times we end up getting more just because we're not as hot. Did you have another question?
Yeah, but sometimes I wear a shirt, but it's cheating because the shirt's open and it's not so hot.
Yeah.
You're cutting down half of it or 50% of it, but you're not getting all of it out.
Yes. And someone asked in our last session, if you're wearing clothing, is it important to put on sunscreen underneath the clothing? And clothing does provide you a layer of protection. It depends on the fiber that is used, how dense the fiber is, and whether or not the clothing is wet. They do make clothing out there that has some sun protection built into it. They call it UPF, and those are just things that they've measured, and they know exactly how much protection you're going to get. So if you're someone who, I think long sleeves are a great thing. If you're someone who wears kind of long sleeves that are going to get wet on, and you're going to be outside for a long period of time, for someone who works outside, then it's probably not a bad idea to put some sunscreen on underneath it, just because over that amount of time you're going to be getting a lot of sun that comes through those wet clothing.
Tell me about the wet.
So when clothing is wet, it does not block the rays as well as it does when it's dry. So it mostly has to deal with if it's a cotton or if it's a synthetic blend or whatnot. But all those things play into it. But I would much rather you have a shirt on than no shirt on. That's just, even if it's a wet shirt, it's better than no shirt. Yes.
I used to have a problem with being in the sun without a shirt.
Mm-hmm.
You can even take a layer of my skin and feel it like a snake.
Mm-hmm. Mm-hmm.
So I wear a long sleeve shirt now because even though my arm is shallow, it doesn't happen anymore.
Mm-hmm.
I don't know what the reason behind it, but I know that I had to be covered.
Yes. And there's and in addition, there's lots of different rashes and different reactions you can get in the sun that some people get in the sun, and it can be a sun plus a medicine reaction or a sun allergy. There's lots of different things that play a role in that. And so, sometimes that may be causing the problem more than, anything else. But, the sun plays a role in a lot of the stuff that we do. Mm-hmm.
Multiple layers of clothing helping?
I mean, it would offer you more protection. And I don't want you to think that, if you're just going to have casual sun exposure, just kind of being outside, that you absolutely need to put a 30 underneath your long sleeve shirt. Your long sleeve shirt more than likely it's gonna be pretty good protection for you that day. But definitely, I mean, if you're layering, it would be better. However, that may not be as comfortable because maybe more if it's hot out there, I'm sure that would make it tough.
Oh, when you put sunscreen on it, it's recommended that you put it on again later on.
Mm-hmm.
How often do you have to put it on?
So sunscreen is recommended to be applied 15 minutes before you go out in the sun. And then the reapplication depends on the type of sunscreen. So most of the time we say you absolutely need to reapply it every 2 hours. If you're going to be in the water or if you're toweling off, then it's going to need to be applied much faster. And then the water, there's two different phrases they use. There's 40-minute water resistant, and I think there's 80-minute water resistant. That's the new terminology that they've come out with. So that kind of tells you if you're in the water, how often you need to reapply it. But then if you towel off, a lot of times you're going to be toweling off your sunscreen. So if you're someone who sweats a lot and you're wiping down, that's a good time to put it back on.
The drugs that tell you that you may be more susceptible to sunburn, what are they doing to you that's causing that?
So most of these drugs will decrease what we call the minimal erythema dose. And so they interact with your ability to, so most of our cells have melanin, which is the color pigment, and it releases that melanin that's preformed on exposure to the sun to try to protect itself, to protect its DNA. And so a lot of times these drugs interact with that and they decrease your minimal erythema dose. So whereas it may have taken 2 hours to burn you, now it's going to take an hour to burn you or something like that.
So your cells aren't able to react to the exposure.
Yeah, and they're more sensitive to it. Did you have a question?
So as you lose more hair, as you get older, you need to put sunscreen on your head
Yes.
and reapply it in the middle of the day?
Yes. Or wear a hat.
I guess I'm gonna be looking for some gloves sometime soon. My back of my hand gets a lot of sun.
Yes. Yeah, they do. There was I have a picture on my cell phone that sometimes I'll show patients, but they produced a picture several years ago of a gentleman who drove a truck for a living, and it is so impressive it's a picture from the front to see the left side of his face compared to the right side of his face. Now, he was never outside in the sun, but he drove a truck all the time, and the left side of his face looked about 30 years older than the right side of his face. And we do see skin cancer much more frequently on the left hand and the left side of the face than we do see on the right side of the face. And it's that little bit of sun that you get all the time, just from our daily activities that we don't think about, that adds up.
And your car windows aren't protecting you.
So if you're not adding any kind of tint, then it doesn't really protect you all that much. Now, there are certain levels of tint that you can get that does provide you protection, and most of those you don't even need a doctor's excuse for. That can give you the protection to decrease the amount of rays that are coming through. So much sunscreen. There's actually a pill that they're using in Europe called Alphamilenatide that kind of, they say if you take it, it makes your skin kind of orangey, and it protects your skin from the sun. They're using it in certain types of we call photosensitive disorders, meaning that you're very, very sensitive to the sun. It also has an extremely high number of side effects, and is not available in America. So that's the only thing that's out there that touts that, kind of is like sunscreen from the inside. I know that there are several companies working on something similar like that here. I don't know. To me, I'd much rather just put on sunscreen than take the risk of ingesting something that could have some side effects.
There's no study on any dye or anything?
No, I mean antioxidants, which are going to be found in your fruits and your vegetables. Now, those help with just cancer fighting in general. So it's those types of vitamins, vitamin E, vitamin C, all of those things are good just to kind of help boost your system's ability to fight. And oxidation is one of the mechanisms through which DNA is damaged. And so when you're taking an antioxidant, you're kind of helping to prevent that and kind of boost those things. So, but it doesn't necessarily make you any less susceptible to the sun. It's not like a replacement for the sunscreen. Yes?
What exactly is a mole and what causes it?
So a mole is composed of nevoid cells, which nevoid cells are melanocytes. Melanocytes are our color cells, and nevoid cells meaning that they're melanocytes that are grouped together. And we see this when we're looking underneath the microscope at a specimen. So that is what constitutes a mole. Okay, now you have moles that are pink, you have moles that are brown, you have moles that are red, and you have moles that are black. But that in and of itself is what a mole is. Majority of moles out there are going to be harmless, and moles can change over your lifetime, particularly those kind of, you may have one that's kind of tan that tends to kind of puff up and gets palpable, and then it starts growing hairs and it loses its color as you get older. Like I said, there's lots of different moles out there, but it's all characterized by whether or not it has these particular types of cells that are kind of packaged together underneath the skin.
Question. These chemicals that are used in the sunscreens, can they be detrimental, more detrimental than helpful, some of them?
So, there's lots and lots of articles about this if you're on the internet and looking at media these days. Some of the chemical sunscreens, when you feed it to rats, like 1,000 times the amount that we use in our sunscreen products, it can have effects on estrogen and on other things like that. But, very little of it actually gets absorbed in your skin when you're applying sunscreen. And so I think, for the most part, I think those studies are scaring a lot of people, but I think it's kind of unfounded because we're not ingesting it and we're not using the amounts that they use in these studies that they're kind of basing that off of. But I know that there's lots of articles I've seen friends send me all the time, about that. But there's been no studies that show that applying the sunscreen and the concentration of ingredients that we use that has any harmful, deleterious effects.
Is there a website for these other seminars we didn't get to go to? That we have a later date?
I don't know that answer.
They said they were gonna have a website, I think, before we leave. But I didn't see it, I must have a whole bunch of it. But they said they were gonna have a website.
All right. Well, thank you. If you have any other questions, I'll stick around for a few minutes. I think there's jambalaya